Can I eat candy and sugar all the time and don't get any cavities? Is it possible? Well, let's think about it. I'm Dr. Olga Doger here at Palm Valley Pediatric Dentistry and Orthodontics, and we get this question a lot. Can I have sugar? How much sugar should I have? Why don't I get her cavities and she does? And so on. So what sugar causes and why do we get cavities from sugar? If I eat sugar all day long, would I get cavity? Or if I eat one candy a month, would I get cavity? All these questions, so much confusion. So let's dig in. In order for you to form a cavity, you need to have, number one, the source. The source is bacteria which cause cavity. Number two, you need a sugar which serves as a glue to stick bacteria to the tooth. And number three, tooth. If you don't have teeth in the mouth, you have cavity free for sure, because there is nowhere for bacteria to stick. So let's talk about bacteria. Number one reason bacteria which cause cavities are actually strep mutans. We determined by microscope, by all those special scientific experiments, and we determined that there is actually a type of bacteria. But some people have bacteria and don't get cavities. So why is that? So that also relates to what overall your microflora, what kind of bacteria grows in your mouth. Some of us have protective bacteria, good bacteria. We heard about probiotics, bacteria which actually fights the bad ones. So there's like a balance between good ones and bad ones. And some of us has mouths where the bad bacteria overgrowing and the good bacteria kind of staying down. So those people are more prone to cavities. So microflora. Second one is your sugar intake. So if you eat one candy a month, nothing will happen to you. Periodically, indulgement of those yummy candy or whatever you like, sweets, is okay. The one who get cavities is the ones who eat candy as a snack. So they have a pocket and they have those little suckers or gummies, a chewy type of candy which stick to your teeth, or high sour candy or high concentration of glucose or fructose candy. They are the worst type of candy. It doesn't matter how much, it matters how often. So if you constantly snack on sugar type of candy, you will get kind of cavity most likely. So frequency, that's very important, frequency. And then the mouth, the teeth. If you have special grooves which are very deep and you cannot brush them well, then those bacteria can find a way and kind of hang on in there, and then the sugar comes in, bacteria sticks to the sugar, you're more prone to cavities because of the anatomy of your teeth. Number two, if you have dry mouth, if you take medications, for example, if you have asthma, it makes your mouth more dry and you don't have enough producing saliva in your mouth for whatever reason, maybe your salivary glands don't work as well, aging, that would prompt you to get less saliva flow, less washing off those bacteria and sugars, then you are more prone to cavities. Also, if you're not brushing your teeth, we keep talking about flossing, brushing, flossing, brushing, flossing, brushing. If you are the one who are prone to cavities because whatever reason, your bacteria, anatomy of your teeth, pH of your mouth, everything line up not in your favor. If you brush your teeth every single day, twice a day with toothpaste with fluoride or hydroxyapatite, those are newer ones, then you should not get them as often. So it all depends. Oral hygiene is the key. And also what you eat. It's not just candy. Sometimes we see simple carbohydrates, the hidden sugars, we talk about it, like granola bars. If you look at the ingredients on granola bars, you might be surprised to see high fructose corn syrup in them or high amount of different carbohydrates in general. So all of those break down in our mouth to simple sugars, so that bacteria which cause cavities can hold on to that glue and go to your tooth, okay? That's the whole process of creating cavities in your mouth. So some people are more prone, some people are less prone, but I think it's more also depends on their habits, their oral hygiene, and genetical predisposition to it. So don't blame just genetics. Look at the big picture. So it's not just one element why you get cavities more often. It's also other things which you have to worry about. Share with me, do you get cavities a lot? Do you eat a lot of candy and nothing happens to you? Maybe you're the lucky one. Cannot wait to hear and see your comments. Thank you so much for watching.